Welcome to our exploration of healing after periodontal therapy. In this video, we'll break down the essential aspects that determine the success of periodontal treatment: regeneration, repair, and new attachment. Understanding these processes is crucial for both dental professionals and patients, as they directly impact the restoration of oral health. We'll also look at how different cell types contribute to healing and what outcomes can be expected depending on the sequence of cellular events. Let's begin by defining the key terms and setting the stage for a deeper dive into the healing process. Regeneration is a remarkable biological process where the architecture and function of lost periodontal tissues are completely restored. This means that after therapy, new periodontal ligament, alveolar bone, and cementum are formed, essentially bringing the affected area back to its original state. Regeneration is the ideal outcome in periodontal therapy, as it ensures the full recovery of both structure and function. Achieving true regeneration is challenging, but advances in dental science continue to improve our ability to restore lost tissues. Repair, in the context of periodontal healing, refers to the process where tissues heal without fully restoring the lost structures. While the area may recover and function adequately, the original architecture is not completely re-established. This means that although the tissues are healthy, they may not be exactly as they were before the disease or injury. Repair is a common outcome and still represents a positive step towards oral health, but it falls short of the complete restoration seen in regeneration. New attachment is a specific type of healing where the connective tissue reunites with a root surface that was previously exposed due to disease. This process is significant because it restores the connection between the tooth and its supporting structures, helping to stabilize the tooth and prevent further damage. New attachment is a key goal in periodontal therapy, especially in cases where the root surface has been pathologically exposed. Reattachment refers to the reunion of connective tissue and a root surface that were separated by incision or injury, not by disease. This is different from new attachment, as the separation was not due to pathological exposure, but rather a result of surgical intervention or trauma. Reattachment is important for restoring the integrity of the periodontium after procedures that temporarily disrupt the connection between the tooth and its supporting tissues. During the healing of periodontal pockets, several types of cells invade the area to initiate repair or regeneration. These cells come from four main sources: the epithelium, gingival connective tissue, bone, and the periodontal ligament. Each cell type plays a unique role in the healing process, and the sequence in which they arrive can significantly influence the final outcome. Understanding these cellular dynamics is crucial for predicting and guiding healing after periodontal therapy. If epithelial cells are the first to proliferate along the tooth surface during healing, they form what is known as a long junctional epithelium. This type of healing creates a barrier, but does not restore the original attachment apparatus. While it helps seal the area and prevent further infection, it does not provide the same level of support as true regeneration. The timing and dominance of epithelial cell migration are critical factors in determining the nature of the healed tissue. When connective tissue cells populate the healing area, the result is the formation of fibers that run parallel to the tooth surface. This arrangement supports some remodeling of bone, but does not lead to new attachment to the cementum. While this outcome is better than no healing, it still falls short of the ideal, as the original structure and function are not fully restored. The presence and activity of connective tissue cells are important, but their dominance limits the potential for complete regeneration. If bone cells are the first to reach the healing site, the outcome can be less favorable. Early bone cell dominance may lead to root resorption, where the root surface is broken down, and ankylosis, a condition where the tooth becomes fused to the bone. Both of these outcomes compromise tooth stability and function. Therefore, controlling the sequence of cellular events is vital for achieving the best possible healing after periodontal therapy. The most desirable outcome occurs when cells from the periodontal ligament proliferate coronally during healing. These cells are capable of forming new cementum and periodontal ligament, which are essential for true regeneration. The periodontal ligament acts as a bridge, connecting the tooth to the alveolar bone and supporting the overall structure. Ensuring that these cells dominate the healing process is a key goal in advanced periodontal therapy. Melcher emphasized that regeneration of the periodontal ligament is the key to new attachment. This is because the periodontal ligament not only provides continuity between the alveolar bone and cementum, but also contains cells capable of synthesizing and remodeling all three connective tissues that support the periodontium. This insight has shaped modern approaches to periodontal therapy, focusing on techniques that encourage periodontal ligament cell proliferation. To better understand the sequence of events during periodontal healing, let's look at a flowchart that outlines the possible cellular pathways and their outcomes. This visual representation helps clarify how the dominance of different cell types leads to various healing results, from long junctional epithelium to true regeneration. Recognizing these pathways is essential for clinicians aiming to guide healing towards the most favorable outcome. Understanding the cellular dynamics of periodontal healing has direct clinical implications. By manipulating the healing environment, clinicians can encourage the dominance of periodontal ligament cells, increasing the chances of true regeneration. Techniques such as guided tissue regeneration and the use of growth factors are designed to optimize these cellular events. The ultimate goal is to restore both the structure and function of the periodontium for long-term oral health. Guided tissue regeneration, GTR, is a technique used to direct the growth of new periodontal tissues. By placing a barrier membrane, clinicians can prevent unwanted cell types, such as epithelial cells, from populating the healing area. This allows periodontal ligament and bone cells to dominate, increasing the likelihood of true regeneration. GTR has become a cornerstone in advanced periodontal therapy. Growth factors are signaling molecules that can enhance the healing process by stimulating cell proliferation and differentiation. In periodontal therapy, specific growth factors are used to encourage the regeneration of bone, cementum, and periodontal ligament. These biological agents are often combined with other regenerative techniques to maximize healing and improve clinical outcomes. The success of periodontal healing is not determined by clinical techniques alone. Patient factors such as oral hygiene, systemic health, and lifestyle choices play a significant role. Good oral hygiene practices, control of systemic conditions like diabetes, and avoiding smoking can all enhance the body's ability to heal and regenerate tissues after periodontal therapy. After periodontal therapy, regular follow-up visits are essential to monitor the healing process. Dentists assess tissue response, check for signs of regeneration or repair, and make adjustments to the treatment plan as needed. Early detection of complications allows for timely intervention, ensuring the best possible outcome for the patient. The outcome of periodontal healing can vary widely. Some patients achieve true regeneration, while others may experience repair or long junctional epithelium formation. Factors such as the extent of tissue loss, the type of therapy used, and patient compliance all influence the final result. Understanding these possibilities helps set realistic expectations for both clinicians and patients. Preventing complications during the healing process is a shared responsibility between the dental team and the patient. Proper technique during therapy, patient education, and adherence to post-operative instructions all contribute to minimizing risks such as infection, root resorption, or ankylosis. Prevention is always better than cure, especially in the delicate environment of periodontal healing. Research in periodontal regeneration is ongoing. with new materials, techniques, and biological agents being developed to improve healing outcomes. Stem cell therapy, tissue engineering, and advanced biomaterials hold promise for the future of periodontal therapy. Staying informed about these advances ensures that patients receive the most effective and up-to-date care. In summary, healing after periodontal therapy involves a complex interplay of cellular events that determine whether regeneration, repair, or new attachment occurs. By understanding these processes and the factors that influence them, both clinicians and patients can work together to achieve the best possible outcomes. Remember, successful healing is the result of effective therapy, patient cooperation, and ongoing advances in dental science.